we'll hear from Douglas Bosire, who's the Acting Chief Executive Officer, National Syndemic Disease Control Council, and he'll talk about the commitment plan to end the triple threat.
Thank you very much, ladies and gentlemen. Just to connect from where Dr. Mary left, I just want to tell you that the connection between one of the cancers and HIV is what he talked about, cervical cancer. That a woman living with HIV is 6 times more likely to be infected by the human papilloma virus that causes cervical cancer than a woman who does not have HIV. So we are going to progress that discussion, and my presentation is titled A Race Against Time. In 1984, Kenya diagnosed the first case of HIV in this country. 40 years down the road, we have the 6th largest epidemic in Africa and 7th largest cohort of people living with HIV globally, standing at about 1.4 million people. Now, this number has successfully been maintained. About 95% of this number, 1.4 million, has successfully been maintained on care and treatment over the last about 25, 30 years. And courtesy of that, today, we have almost 1.378 million Kenyans who are on ARV treatment, on life-saving medication that they require to continue doing the activities on a day-to-day basis, that they require to raise children who are HIV negative and contribute to the socio-economic development of our country. It has not been an easy journey. If, for example, you go back about 20 years to 2005, in 2005, we had about 94,000 new HIV infection in that year. In 2023, we had 16,752. In the same year, 2005, we had 110,000 deaths due to HIV-related illnesses. In the year 2023, we had 20,480 deaths. In that year, 2005, we had 35% prevalence of mother-to-child transmission. That means out of 100 mothers who are HIV positive, 35% passed on the virus to their children. But now, we are talking about 7.3% who are passing the virus to their children. So those are remarkable progresses that we have made as a nation, and that could not have been possible without the serious, heavy investment of the country, of the government, and of our development partners, particularly the US government and the Global Fund. Currently, this is how the snapshot of our nation looks like. I've told you about 1.4 million people living with the virus. Unfortunately, this epidemic has the face of women, because out of those 1.4 million, almost 890,000 are women, whereas about 480,000 are men. However, when you look at the mortality, the number that I've told you, 20,480 we lost in 2023, about 50-50. 50% of them were women, 50% were men. So in a space where 65% of the people living with the virus are women and 35% are men, but the deaths are almost equal. That means it has a female face, but men are disproportionately dying more than women. Because if you went by those proportions, then you would have expected a larger number of women to die than men. Why are men dying more than women? Your guess is as good as mine. Health-seeking behavior, coming to test rate, because testing is the pathway to care and treatment. So the man will wait for his expectant wife to go to the ANC clinic and bring home results that she's negative. And the man assumes he's also negative. Not understanding that there is the element of discordant couples where I might be HIV positive, but my wife is negative. So those kind of habits, those kind of characteristics are what now we are tracking so that we can know, we can follow the virus. We can know where this virus is expressing itself and therefore accelerate our journey towards 2030, towards ending HIV as a public health threat. That is why we call it a race against time, because as a globe, we have given ourselves a commitment of ending AIDS as a public health threat by 2030. So having been in this race for the last, or in this marathon for the last 40 years, we are only left with 5 years, but you can see the figures you're talking about. So we must race, we must accelerate. And that's why for us it's very important to be here with you today. Of course, there are specific groups there that we'll maybe talk about at another forum. The infection rates are not uniform across the populations. We have some populations which are at higher risk than others. Those ones we call them key populations. Key populations are people like groups like female sex workers, men who have sex with men, people who inject drugs. For example, whereas the national prevalence stands at 3.3% in the general population, among female sex workers, the prevalence is 27%. 27%. So we must have programs that are tailored at the female sex workers, led by the female sex workers, so that we can prevent this high prevalence from affecting the general population and therefore increasing the general population prevalence from the 3.3%. Where are these people found? 50% of the people living with HIV are in 8 counties in Kenya. Mombasa, Nairobi, Kiambu, Nakuru, Homa Bay, Migori, Kisumu, and Siaya. So almost 700,000 and something are found in those 8 counties. However, those are the counties that have made the biggest strides, because before, almost all the investment, almost all the efforts were targeted towards those high burden counties. What did we do in the program, in that scenario? We neglected other counties that were thought to be low burden counties. These are counties like the northeastern counties, the ASAL counties, Wajir, Mandera, Garissa. Today now, the prevalence of mother-to-child transmission in a county like Wajir is 33%. So we have pockets now of new HIV infections that are concentrated particularly due to vertical transmission from the mothers to the children in those northeastern frontiers. And therefore they are becoming counties of focus for us if we are to end this epidemic as a nation. Something interesting now as I come to the triple threat. When we look at when we look at this data further and ask ourselves, among who are the new infections occurring most? We are not very worried about the prevalence. In fact, we don't want the prevalence to go down rapidly. If it goes down rapidly, it means we are killing people. We want them to live and die a natural death. But the new infections, the tap of new infection is what we must close, because we cannot continue mopping the room when the tap is open. So when we look at that tap of new infections, the 16,752 I talked about, out of those about 13,000 are 15 years and above. That's what we call adult infections. So out of those adult infections, 39% of them occurred among adults, among adolescents and young persons aged between 15 and 24 years. 39%, almost half. When you expand that bracket a little bit to 34 years, between 15 and 34 years, accounted for 73% of all the new HIV infections in the year 2023. That is it's a red flag for us. It's something that we came together with other agencies and just try to understand this data. So we came together with National Council of Population and Development, which is under the State Department for Planning, under the National Treasury. We came together with the State Department for Gender and Affirmative Action, because they are charged with ending all forms of sexual and gender-based violence. And National Council, NCPD, is charged with ending adolescent pregnancies by the year 2030. We tried to overlay data across the country, and we found that where there are high number of adolescent pregnancies, there are also high number of sexual and gender-based violence cases, and there is equally a high number of new HIV infections. So we asked ourselves, what might be happening? We came up with this diagram that depicts that malignant triad, that interconnectivity intersectionality between new HIV infections, adolescent pregnancies, and sexual and gender-based violence among adolescents. And we dubbed this the triple threat towards ending HIV as a public health threat in the country. So we came up with an initiative that we have been running together with our partners, both state and non-state, different sectors within government, Ministry of Education, Ministry of Interior, and all the other line ministries that are concerned, because ending HIV is our role, all of us, plus the religious leaders, plus the media. We came together and started on this national initiative that was aiming at not reversing this trend. Ladies and gentlemen, the children we are talking about today, the young people we are talking about today, aged between 15 and 35, definitely these people were born after the 1990s. The 1990s were the worst era in the HIV history of this country and of the world in totality. So these young people, because they are about 25 years, 30 years, they never saw that picture that you are seeing there on, on my right, which is on your right as well. They did not see the emaciated frames of individuals who are having what we call the full-blown HIV disease, what we call advanced HIV disease, otherwise known as AIDS. They did not see this. So to them, to these young people, what do they fear most? They fear pregnancy more than even the virus. Because they think the virus, because they cannot see it, because they look at me, they look at you, and they do not see any face of a virus because you're on treatment, because maybe I'm on treatment, so they don't see. However, this program is supported through a robust program of expensive medications called antiretroviral drugs. Per person, we require about 15,000 each year to keep a person living with HIV on treatment. In the country, we need about 25 billion shillings. 25 billion, you and I can tell where that money can be otherwise invested if we do not have these cases. So that's what we are trying to close so that we do not increase the amount that we are investing. So that, in the year 2023 alone, we lost 2,083 children between 10 and 19 adolescents due to the virus. No, sorry, not we lost. We had 2,083 new infections among children aged between 10 and 19. Unfortunately, if you want to know how worse this situation is, if you can take your calculator later and divide 252,000, divide by 365, you will get a number of about 690. 690 are the number of children, girls between 10 and 19, who presented in our health facilities in the country with pregnancy per day in the year 2023. 690 per day. Young children who are supposed to be in school, like my daughter who is supposed to be in school. She's 14 years. But then they were presenting where? In the health facility with pregnancy. The only pregnancy that I've read in my life that was not caused by a man is one. And you know that pregnancy. So these pregnancies are being caused by men, by we who are in this room, or by our friends, by our brothers and by our sisters. That is why in this journey of ours towards ending the triple threat, men and boys are the center of it. We have been discussing, we have been having discourses with men so that we can become better influencers of society. So that we can become champions of our own families, communities, and societies where we come from and the nation. Because we are the ones who are contributing to this. And in the process of passing on these sperms of mine to this young child, I'll also pass on syphilis. I'll also pass on gonorrhea. I'll also pass on, other issues, other conditions. And I'll psychologically torment this girl forever. It's not, the girl will drop out of school. So the demographic dividend that we were expecting to harness from this young girl is lost as a country forever. As a family, it's lost also. So that's why for us, it's very important that we break this nexus. And we've been doing this all over the country. We have counties which are doing better than others. Homa Bay is doing very well. They have reduced new HIV infections among those adolescents by almost 75% between 2020 and 2023. But you see on the left there are counties which are reversing. Which counties are those? The ones I talked about. The ones which were either to consider to be low burden. Wajir, Garissa, Mandera. That is where we are going next. That's where we have to focus if we have to control this epidemic. Adolescent pregnancy, I've explained to you, the trends are showing that it's coming down. But 690 per day, it's not acceptable. For me as a father, I cannot say that we are doing well. We are not doing well in that space. In terms of sexual and gender-based violence, out of all the cases that were seen for SGBV in our facilities in the year 2023, 37% were children aged between 10 and 17. 10 and 17. These are children who do not know even how to seek health services, who will go to the facility late and therefore end up seroconverting if they were defiled and they access services late. Therefore, their risk of seroconverting and developing HIV or getting the HIV infection established in their bodies is enhanced as compared to adults. 37%. This is what I'm talking about. An example, if I can just show you here, out of this number of children, 8,067, who reported to the facility within 72 hours, 184. These are between 10 and 17, 184 seroconverted after 3 months, as opposed to the adults who only 148 out of 11,000. That means the proportionality of seroconversion among the 10 to 17 is much higher than among the adults, and therefore we need to break that nexus. So this is the initiative. It's a whole of society initiative. It doesn't care if you are in private sector. It doesn't care if you are in the government sector. It doesn't care if you are a development partner, implementing partner, or a member from the civil space, from the civil society, a community health promoter, an assistant chief or chief. We are all inside this response, this initiative to end the triple threat. So we have a national steering committee, we have a national thematic working group that is also multi-sectoral. At the county level, we have aligned to the UHC agenda in terms of the Primary Health Care Act of 2019, where we have these structures the Primary Health Act of 2023, not 2019. So we have coordinating committees at the county and sub-county level. We have county adolescent and young people technical working groups across the 47 counties, by the way. We have domesticated a program, a curriculum for our national government administrative officers and our CHPs, so that the information that is passed in Mandera is the same information that the people of Diwa are given without causing confusion or without misrepresenting facts, because these are people who are not public health specialists, and therefore we want to standardize the way this information is passed so that the country moves together forward. Remember, this virus does not know the boundary between Baringo and Elgeyo Marakwet counties. It does not know the boundary between Kenya and Uganda. It does not know the boundary. That's why even those figures that I showed you earlier, it shows you that this is, in Africa, it is predominantly Eastern and Southern Africa. South Africa, Zimbabwe, Zambia, Mozambique, Tanzania, Kenya, Uganda, those are the countries that are featuring there. From West Africa, we only have one country, Nigeria, because of the population size that they have. These are the kind of engagements that we normally have with these people. We have met about 300,000 directly over the last 2 years, one-on-one like you, like what we are doing here. We go and sit under a tree, under a tent. We provide bread and soda. The cost of having you in a hotel like Pan-Afric would have been about 5,000. But with that cost, we meet about 10 people seated in this way, community champions at the lowest level of community, so that we can engage with them, we can stretch the coin and have a greater impact. You can see the national government administrative officers. We have trained almost all of them across the country, by the way. We are working very well with the interior. These are our CHPs, our frontline foot soldiers in the health sector. We have gone to Samburu, converted those mothers in Samburu into and those Morans into warriors against HIV and the triple threat. I think we have worked with the governors. That's Homa Bay. That is
Mr. Bosire, we need you to start winding up.
Yes. That is the national leadership that we are working with. This photo is very important for me. It depicts what we should do in our response in the county to sustain it. You can see the gentleman in the middle is the governor for Elgeyo Marakwet. He's our champion. He's one of our foremost champions. On his right is Father Dominic Kimengich. Those ones who know, Bishop Dominic Kimengich of Eldoret. Here is the MP for that area where we went. There behind the governor is the senator. Next to the governor is the MCA. Right behind the governor, the tall gentleman is the CEC member for health. So we brought them all together. It was in a Catholic diocese. And we talked about human sexuality. We talked about the issues that are affecting our young people. And this is what we are trying to promote. All of our religious leaders are on board. We must commit to end the triple threat. And what we did, we came together as the different sectors. And where is the commitment plan? We have a commitment plan. We'll show you when you visit our stand, you will see it. We have committed to do that which we are supposed to do as sectors, so that we can end this commitment plan. These are commitments that have been signed on to by different ministries, departments, and agencies. And what we ask from Nation Media, as I finish, the words of Kofi Annan, that you are a voice that is trusted and listened by young people, by people of all groups across the world. So what we need from you is to continue this discourse as you have given us a chance today, progress the discourse of prevention, progress the discourse of awareness creation and of education, because that's where we have the biggest gap. That's where these young people need to be informed. And together we must commit and account for every Kenyan child. Thank you very much, and may God bless you.
Thank you very much, ladies and gentlemen, for your patience. We have finally made it to the end of the day. Thank you for those of you who've been here since morning. Asanteni sana for your patience. It's been quite the long day. I hope you had takeaways of what you took from each of the panels. We'd like to hear from you what your thoughts are about the conversations, the engagement here. You can engage with us on all of our social media platforms, and when we start tomorrow, we will be able to sample some of your thoughts. But some of the things that came up included building a healthier Kenya means putting the most marginalized at the center and scaling down these health services everywhere. So speaker after speaker, they all talked about collective action. We must work together in order to solve this problem. My name is Zena Bondati. I hope to see you again tomorrow morning, and enjoy the rest of your day. See you tomorrow.